Hi everybody, this is Kyle Sears from ZOLL Medical. Today's ZOLL Zenix tips and tricks series is going to focus on the automatic blood pressure on the Zenix. So a lot of this is going to be best practices. Right? We talk a lot about the importance of the sizing and placement of the cuff. Really the easiest thing to think about is treating this like an ECG electrode. So the same way you would never put an ECG electrode on top of a patient's shirt or jacket, you would never put a blood pressure cuff on top of a patient's shirt or jacket. You want direct skin to cuff contact in all situations. That's going to give you your best chance of getting a good, fast, accurate blood pressure. The sizing is extremely important as well. You'll have multiple size cuffs ranging from standard adult to large adult, small adult, and child. They all clip in and out at the same junction point right here, just like that. When you go to place the cuff on the patient's arm, it's very important that the artery index marker is running down the brachial artery line of the patient's arm. When you go to close that cuff down, the index marker should be between the two range markers on the cuff. Like that would be the perfect size cuff for this particular patient. A cuff that's going to be too big is going to wrap past that range marker, and that's going to give you lower than normal blood pressures. And a cuff that's too small is not going to hit that range marker, and that's going to give you higher than normal blood pressures. So very important to have the right size cuff. Artery index marker lined up running down the brachial artery line. Wrap the cuff around the patient. You want to try to get the level of their arm below the level of their heart. And then you start the blood pressure just by tapping the NIBP cuff section right on the bottom left corner of the device. If you want to make any adjustments, for example, putting the device into automatic blood pressure mode, you can go into this section right here and you can change it from manual to auto, again, based on how your device is configured and set up, ready to go. If you're having a hard time getting a blood pressure, there's technology in the Zenix device that will synchronize with the R wave of the patient's QRS complex. In order for that to happen, you want to make sure the ECG electrodes are placed on the patient. So think of situations where you're driving to the hospital, you might have a bumpy road that you're transporting the patient on. If you don't already have the limb leads on the patient, put those on. That's going to help the machine hear and recognize the patient's QRS complex, which will give you a more accurate blood pressure as well. If for some reason the device is incapable or unable to acquire a blood pressure, or it gets an erroneous blood pressure reading, you may see a little star indicated above the number in the blood pressure section. So if you see a number with a star, that's the machine just basically saying, hey, there was too much artifact, there was too much noise. I can't, with any level of confidence, tell you that this blood pressure is accurate, at which point you're going to take another blood pressure. If you need to take another blood pressure, hit the button again, it'll light up and you'll start to hear the pump go again. Hopefully that helps. Please let me know if you have any questions. Thank you.